tiny virus particles can actually linger in the air.
Turns out the coronavirus can stay in the air longer than previously thought, especially indoors.
One of the big questions is, if in fact COVID-19 is airborne, what does that mean in terms of transmission? There's increasing information that suggests that COVID-19 can remain airborne. There are also a few epidemiologic studies that would suggest this as well. One is an outbreak that occurred in a restaurant in China where there was transmission among people that were far more than 6 feet apart from each other. There's also the episodes of choir practice where others have been infected despite some physical distancing. But the majority of cases still appear to be from these heavier droplets, from droplet transmission from the nose and the mouth, these particles that come out, they drop down, they infect those who are relatively close to you. Certainly when people are in closed indoor spaces that don't have good ventilation, good access to outside fresh air, the risk is higher. There's an increasing emphasis on fresh air being available, even opening windows. If you're outdoors, there's naturally more air exchange, there's more air movement, and that's good for reducing transmission. People are wondering how concerning or dangerous is it to do things like go to the grocery store or get a haircut. So certainly safe to go to a grocery store if you remain far apart from others. If you're wearing a mask, hair cutting, you're a little closer to your hair cutter. Very important for the person who's cutting your hair to be wearing a mask. These kinds of activities have to be evaluated one by one to see how much space are there between people, how well are people wearing face masks, and how much air exchange is happening, how open does it feel to you.